I always forget to turn the recording on, so I'm doing it now. Okay, we've got about 8 people in the waiting room and it's 7, so I'm going to go ahead and admit them if that's okay with you.
Perfect.
Okay. And I'll keep clicking. Okay. Hey, everybody, welcome. We're just letting now the last minute folks, or I guess top of the hour folks, the on time folks join, and then go ahead and get going. Thanks for being here today. You can leave your cameras on or turn them off. Go ahead and leave your microphones on mute for now. And I know Dr. Ross is going to take questions at the end. Do you want people to kind of pose questions throughout? And do you want to pause like halfway through for questions, or do you want to just take them all at the end, Dr. Ross?
What do you guys normally do? What's usually kind of?
It depends. Like the in-person ones we have, you're obviously like right there, so someone raises their hand.
Yeah. Either way, I don't see the chat. So would you tell me, or is there a chat, or?
There is a chat. Yeah, so I'll monitor the chat, so you don't have to worry about that. And then when we see questions, I'll just read the questions to you. And if we need more information, we can ask the person to unmute if that's cool with you.
Yep. Yeah, that works.
Cool. Awesome. 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 Fabulous. Okay. Well, we'll go ahead and get started. We are recording the presentation part of this. We typically turn it off for the Q&A so that no one needs to worry about their, questions about their kids being out there on the internet somewhere. But I want to welcome everybody to tonight's ADHDKC parent meeting. Tonight, we're going to be talking about unlocking potential and integrating natural solutions for improved ADHD symptom control, which is super fabulous. Our guest this evening is Dr. Pahini Ross, and I'm going to let her introduce herself and tell us all about how fabulous she is in just a second. But first, I need to read the CHAD disclaimer, and hopefully we all have it memorized by now. And that is that CHAD does not endorse any products, services, publications, medications, or treatments. So, one housekeeping note, our presentation next month is not going to be in person at Horizon Academy. It's going to be virtual. And we're going to be working with the folks from the Tourette Association to talk about tics and driving with ADHD. And we're going to have some young adults with ADHD and Tourette syndrome talk about what it's like to drive with both ADHD and Tourette. So that'll be a virtual presentation instead of in person at Horizon. And we'll make sure you guys get copies of the link. Okay, so with that, I'm going to turn it over to Dr. Ross. Take it away.
Hey, awesome. Well, thank you everyone for joining. I'm so excited to talk to you all about incorporating natural solutions for your child's ADHD symptom control. I'm just going to talk a little bit quickly about me so you know what I do. I am a doctor of pharmacy. I actually work in the hospital setting. I've worked for 12 years as a clinical hospital pharmacist. For any of you that know, I work for HCA hospitals. So the local ones around here would be Menorah and Overland Park Regional, and then Research Medical Center and some on the Missouri side. But just a little background, and I am a board certified functional medicine practitioner. I'm also a clinical nutritionist, and then I've done an extra fellowship, a 1-year fellowship of pediatric integrative medicine. And just something I do on the side I thought I would talk about is I've been working with Overland Park to reduce the use of some of the toxic chemicals they use on the parks and playgrounds that our kids play on. That's something I'll touch on our presentation as well. And I'm mom to 3 awesome boys. I also have a dog that's a boy, so we're kind of ruled over by boys in our house. So I thought I would start by just talking about what is conventional medicine, and then I'll introduce the topic of integrative medicine to give an idea of how the two can interplay together. So conventional medicine is what we know as Western medicine. So it's getting history and physicals done by your physician, nurse practitioner, well child visits, using prescription medication as needed, preventative healthcare, sick visits, emergency care, and hospital admissions. Now, integrative medicine refers to helping individuals, families, communities, and populations to really improve their health in multiple interconnected domains. So that could be biological, behavioral, social, environmental, rather than just treating the disease. And so a lot of times integrative medicine is referred to as whole person or whole child medicine. And so that's where you see the whole child and use his or her unique combination of strengths, weaknesses, in the context of family, friends, school, and community, and not just a set of symptoms to fix. So a lot of times I like to show this wheel here as a way of how do we look at the whole child. So we look at diet and nutrition, stress management and coping skills. Sleep is a huge one. Movement and exercise, utilizing mindfulness and spiritual practices, and also addressing environmental triggers. That could be, at home, at school, and just the environment in general. So a lot of times what I tell people to do is put their child in the middle of this wheel, and then you explore all the avenues of their lifestyle, really looking at the child from a 360-degree angle. And a lot of times just working on some areas of their physical environment, either at home or school, can really make a huge difference in their success. So today's presentation, as I was kind of working on this, I wanted to talk about all these areas. And as I made all these slides, I realized I probably don't have enough time to talk about all of them. So I'm going to focus more on the nutrition and nutrients and supplements portion as integrative approaches for ADHD. And then if you all are interested, I have some other areas that I'll talk about at the end, but maybe if you guys enjoy this, I'd be happy to touch on different topics at another time too. This is just a disclaimer that, always talk to your doctor about any changes that you make in diet and supplements and exercise routines, just as an FYI. So getting started, nutrition, I always like to say food is medicine. One of the most researched diets out there for a lot of health conditions is the anti-inflammatory Mediterranean diet. There's several health benefits, but focusing on ADHD and behavioral, there's been studies to show improved academic performance in school, less sensory processing abnormalities, and it's also associated with less ADHD symptoms. So some of the basics for the anti-inflammatory diet would be to limit and avoid some of the following foods. So that would be processed foods, preservatives, added sugars, artificial food colors, and flavors. It's kind of, some kids are affected differently than others. So I don't want to say that, every child is affected by a certain processed food. But sometimes when you remove or you reduce some of these things, a lot of parents notice an improvement in their ADHD symptoms. This diet also encourages eating more fresh whole foods, so fruits and vegetables, whole grains, pastas, rice, those types of things. Healthy fats and oils, especially olive oil for the Mediterranean diet. Legumes, whole soy foods, so that would be not soy that is added to packages, but more foods like edamame or tofu, fish, seafood, and then prioritizing water. It is moderate on dairy. A lot of times kids kind of overconsume on dairy, and then we see deficiencies in certain nutrients, which I'll talk about. And then also sometimes overconsumption of dairy might not have kids eating more of a varied diet. So it's moderate dairy because there are some health benefits there of eating good quality dairy. And then you also want to add in things like nuts and seeds, fatty fish, healthy fats like avocado oil or olive oil, eating avocados just by itself, and then utilizing all the benefits of herbs and spices that sometimes get missed, and then also maintaining a normal blood sugar. So I created this template to kind of give an idea of, a general what a plate I would recommend to a child eating is half of it would be fruits and vegetables, a fourth would be whole grains, and then the other fourth would be protein. And so the tips I give is to eat as many colors as you can, a variety of foods, and try to rotate them every 3 to 4 days. So that way your child stays introduced to different types of foods. And then again, prioritizing and focusing more on eating fresh whole foods as much as possible. If you're on your phone, you can definitely just take a screenshot, but I've given some examples of the different types in each category. So in the healthy fats and brain food, we love like coconut oil, olive oil, avocado oil, even ghee is great. Nuts and seeds count as healthy fats. I always like to prioritize water as something to have with meals, so that way we don't fill up on extra unnecessary, calories and sugar. And then you can kind of just see the rest of the other foods here. which you might probably already know about, but whole grains, we can think of whole grains as many different things. There's pastas, there's rice, there's oats, quinoa, there's buckwheat and millet. So there's a lot of fun recipes that you can utilize some of these different grains in. And then protein, of course, grass-fed organic meat or regular meat, poultry like chicken, beef, lamb. And then some people who might not want to eat meat, there's other options too, like beans and legumes and nuts and eggs. So I thought I would focus a little bit on breakfast since we're back to school. And a lot of times parents, they don't know where to start. When you have 3 meals a day, do you just change all 3 meals or do you pick one? I recommend starting with breakfast. Breakfast is super important. There's actually been studies that show that a low glycemic index breakfast is associated with better executive function, better working memory, and better attention. And so in breakfast, I really try to prioritize healthy protein and fat. That will help slow down the absorption of any sugar from the digestive tract into the bloodstream, and allow that blood sugar to rise slowly and steadily throughout the morning instead of spiking and creating that sugar roller coaster that many of you might be familiar with. Also, protein is important for creating some of these neurotransmitters that can help with alertness and focus, while carbohydrates and high sugary foods may induce drowsiness or inattention. So in addition to the healthy protein and fat, I also recommend incorporating some high fiber foods with your breakfast. So things like fruits and vegetables, whole grains, legumes, that can help stabilize energy levels and then also reduce some of that blood sugar variation, which may lead to improved attention. I created this slide to give some basics, just some generic ideas of quick breakfast ideas that kind of translate to what I just talked about. Some tips that I recommend to parents is, even if you are doing maple syrup or, whatever on top of waffles or pancakes, even adding or spreading some nut butter or a seed butter, sunflower seed butter or pumpkin seed butter on top of that, and then putting the maple syrup, well, I'll at least add some extra protein to that meal. You can bulk up better alternative cereals. I get it as a mom to 3 boys that sometimes, you just give cereal and it's fast and we're delayed. But we can bulk that up with crushed nuts. So I have a little nut chopper at home. You can use almonds or cashews. I like Brazil nuts as well. And you can put that in the milk to help stabilize some of the sugars and get some added good fats and protein in. Different seeds are helpful too that you can throw in there, like pumpkin seeds or hemp seeds. Sunflower seeds are great too. Flaxseed meal, and just using fresh fruit in there just will be helpful to get some of that fiber. I created this breakfast recipe guide, which you can scan, and I think you'll get it either after or at some point during this presentation, but you can also click here to get it. There's an awesome waffle recipe in there that uses some Greek yogurt to get some extra protein in there. But I like to throw in Greek yogurt or collagen powder. It's a cleaner version of a protein powder. There's all sorts of protein powders out there. Collagen powder I found is just that's all it is just collagen powder, and there's nothing added in it. And adding that to pancakes or waffles, children don't really notice the change in flavor, but it does give a little added boost of protein. And then I always recommend swapping out, white sugar processed for more natural sugars, which I'm going to have a slide on that of what are better natural sugars. You can also, instead of using pre-made yogurt, you can create a DIY parfait, as I like to call it. I prefer live culture yogurt, so things that have strains in them. When you look at the ingredients, you'll see different strains like lactobacillus or something like that. And then adding fresh fruit, granola, like the nuts and seeds I mentioned, and then honey, a drizzle of honey or maple syrup to sweeten. Again, here is the QR code for that free breakfast guide. And one of the biggest things for breakfast is, since mornings can be so busy, some kids sleep in and some kids are up really early. And the main thing is to try to plan ahead. So if you find any recipes in that breakfast guide that you like, next time you make it, I would recommend making a double batch and then freezing half for the next week. And just try to prepare ahead of time will make everybody's life so much easier in the morning because, I know it's not just me, but if I'm stressed in the morning, my parents probably were stressed, but my kids are stressed, I'm stressed, and it's a lot easier just to kind of be prepared. Another area of consideration to take into is sugar intake. This is just huge for ADHD, but also for other health conditions. The AAP, the American Academy of Pediatrics, recommends just for general pediatric population. So this is not just for ADHD kids, this is for all children. That children 2 years of age and older should have 25 grams or 6 teaspoons of added sugar per day. That doesn't mean you have to reach that, but that's the upper limit that they recommend. And then children less than 2, they actually say to avoid added sugar. So when I say added sugar, we don't count fruits and those natural sugars. We're counting, when you look at an ingredient label, it says added sugar. That's the number that you're looking at. And you want to kind of just be mindful of, how much they're getting per day. So some tips to help reduce that sugar intake. If you notice, if you kind of spend the next few days looking over and seeing maybe how much does my child get, and you want to work on reducing that, some tips to help reduce that sugar intake would be to start reducing foods that contain refined white flour. So a lot of that is some of those packaged foods, breads or desserts and chips. Limiting some of those packaged treats can be really helpful. And especially, after dinner, if there is usually a dessert, maybe swapping that dessert for just fresh fruit. And then using more natural sources of sugar for baking and sweet treats. So I'm going to have a slide on that in just a second. And then really becoming a label reader and seeing, how much it is amazing, because I didn't know either how much was added in some of these snacks that my kids were eating after, soccer or football. And it does add up very quickly. And then limiting juice, soda, and some of those energy and sports drinks, and swapping to some fruit infused water. There's some amazing bottles that they've come up with now that there's like a tube in the middle and you can put in some fresh fruit in there, and then you can fill up the water and it just infuses some of that fresh fruit into the water if your child prefers, a drink versus water. But I have a slide here to give you some suggestions. Coconut water is great. It's high in electrolytes. So if you have a kiddo who plays sports and you're interested in, maybe getting some of those electrolytes, coconut water is great. That does have some added sugar, but you can find some good quality ones at different stores. And then using some of your favorite fruits and creating, like I call it nature's cereal or nature's juice, and drinking it straight from a cup or using a spoon to drink it. Another fun activity that you could do with your kids, and another fun one to get the kids involved, is cutting up fresh fruit and then making ice cubes with them, and then putting them in water and kind of watching them melt, and then eating them and drinking them. And sometimes you can even put sparkling water to make it fun, but just some creative ways to help reduce some of those sugary beverages. Oops. These are the natural sugar swap outs that I mentioned. So if you're cooking or you're adding, some sugar to pancakes, these are, maple syrup, honey, dates is a great one. There is date syrup that's actually just available at the store that you can use. You can also make your own by just buying dates and soaking them in warm water for about 5 minutes, and then blending it up. And you can make like a nice, really sweet date paste with that you can put on top of pancakes or waffles. And they're also pretty high in fiber and iron. So it's just a great natural source of sugar. Coconut sugar has been shown to be better than white sugar. And then even bananas, a lot of times I will use that to swap out sugar in pancake mixes. Another area I wanted to talk about is food and environmental toxins. There is newer data kind of coming out that pesticides in food and the environment may contribute to ADHD development or diagnosis for some children. There was a study that had come out a while ago about kids who had higher concentrations of these organophosphates. Their levels were higher than the median of detectable concentrations, and they actually had double the odds of ADHD compared to those that did not have the detectable levels. So that's an area that I'm just working on in our own city to reduce some of the use of these chemicals on, the playgrounds and the fields that our kids play on, and not just our kids, but our vulnerable population, like our pregnant mamas and, there are our older generations, and then even more susceptible populations that are of, younger age too. So some tips to reduce that exposure, or organic produce. Now I'm going to give a little disclaimer on this because there's so much conflicting, thoughts on this. And so this is just something you can add to your toolbox if you were interested in trying, but I'll explain in my budget-friendly tips that you don't have to be all or nothing, and this should not be a source of worry or stress if you cannot do this or that you don't eat organic. So even if you don't eat organic, you can wash your produce in clean water, or you can even use a solution of water mixed with white vinegar. So I like to use 1 part vinegar to 4 parts water, and you can soak some vegetables and fruits in that for a little bit and then dry them off. You can scrub firm vegetables like potatoes and zucchinis, carrots and things like that with a brush prior to preparation. There is a group, and I've heard, mixed things about them as well, but the Environmental Working Group has a Dirty Dozen and a Clean 15 list for recommendations for which they consider fruits and vegetables. The Dirty Dozen, which they consider to have a higher concentration of pesticides, and then they have a Clean 15 list of fruits and vegetables that they say or that they believe have less amount of those pesticides in there. So if you're trying to prioritize your budget and you wanted to try this, you could potentially look at that list and pick some fruits and vegetables on the Dirty Dozen and maybe start buying organic to try, and then, the Clean 15, leaving it as is and just washing it as usual. So just some ideas. Again, there's so much out there, and just because it's organic does not mean that it's pesticide free. It's a little bit less is what they say. And every farm and every company has their own standards, it seems. And so take it for what it is. It's just here to give you some ideas if you were interested in trying it. I believe in balance. My family, we do eat organic, and then we do eat non-organic too at times. So it's really up to you. But I always say that eating non-organic fruits and vegetables is still better than not. So the benefits of eating any fruit or vegetable, in my opinion, far outweighs the risk of the pesticides. So don't let this stop you from eating it. It's just here as a resource if you were interested in trying it. I also put some snack suggestions. I know a lot of parents struggle with that. Kids come home and they're really hungry and they want to eat just, anything that they can get their hands on. That's probably not the best for them, especially before, a sports or an activity. So I like try to give an idea of some pairings. I always like, fruit and nuts, or hummus and pretzels, or guacamole and chips, or any of those dips with maybe even fresh veggie sticks if you have a veggie lover. I also love suggesting rice cakes. If you've seen them, they sell them at many stores. There's different brands, but any brand is fine. And putting nut butter on it and fresh fruit is really good. You can even get a rice cake and put Greek yogurt on it and fresh fruit, and kind of let the child even put whatever toppings they want on it. It could be fun. Having hard-boiled eggs just ready with fresh fruit is another good pairing, and making some homemade energy bites or energy balls is also just another great after-school snack or midday snack if, we're on break from school or something like that. And so here's some nutrition tips to get started if you're kind of like, okay, where do I even start? Like, I get what you're saying. I need to maybe reduce some sugar and eat whole foods, but my kid's not going to do any of that. So I always say to start slow and never do an overhaul. You can try to build meals and snacks around fruits, vegetables, proteins, beans, and whole grains. So having that as the center focus, and then having some sides. I always say you can put what you want your child to eat on the plate, and it's up to them, how much they want to eat and if they want to eat it. But it's up to us what we put on the plate. And another fun idea that that, we do in our house, and I've suggested to others, is having themed dinner nights. So you can learn about different cuisines, and that also gives you the opportunity to use some of these different herbs and spices that maybe you might not use in your typical dishes. So Indian dishes have a lot of turmeric, and that just turmeric in its natural form has a lot of health benefits. Mexican food has, different cumin and different things like that, and Asian food fusion. Just trialing different things and seeing what your family likes. A lot of times when we have picky eaters, I love suggesting doing like a family style or a bar style type dinner. So doing like a baked potato bar or a taco bar, or create your own pizza or a salad bar or even a nacho bar. And you put out all the toppings that you feel comfortable with your child eating, and letting them make it and eat it how they want. Pan roasting vegetables and adding seasonings is another great way to just get a variety in. I love adding vegetables to soups and sauces. It's another great way to just get those veggies in sometimes. I recently talked to somebody about how I made pasta sauce when I was running low on time. Was I boiled a bunch of yellow zucchini in the colors that matched jarred pasta sauce, and like carrots and beets, and then I blended it up in the blender, and then I added it to ready-made pasta sauce. And so that way my kids got some veggies. It was quick. I didn't have time for dinner. So just finding creative ways to get it in sometimes is also helpful. Always eating the rainbow. I love the rainbow. There's so many health benefits for all the different colors. And swapping out some of their favorite snacks for better alternatives. So if there's a snack that you're just like, I know they shouldn't be eating it. There's, now we're in a time where there actually are some better alternatives. They might not always be the cheapest. And so I always tell parents to maybe keep an eye out for when the sale comes, and then buy a package or so and see if they like it before you buy a bunch. And then when the sale comes back, you can always stock up and keep it for future. And then meal planning can be very helpful. Or like I mentioned, for the breakfast, if there is some meals that your family just loves, making just doubling that recipe, and sometimes giving it for lunch the next day or saving it for the next week can be really helpful. And I always say balance is key. We can't have everything just be all about, eating healthy all the time. It's just something you work on and trying to do your best on. And another area I found that when kids get involved, they seem to want to participate in this more nutritious family lifestyle better, even in the shopping, washing fruits and vegetables, the chopping, even gardening. I found to be very helpful for kids who might have some sensory issues, some kids who won't even touch certain textures. Gardening can be helpful for them just to even feel it without even the pressure of eating it. And then I always remind, start slow and be patient and never give up, because you just never know, when they might want to try it. Now I'm going to transition to supplements and nutrients for ADHD. I know this is a topic that a lot of people are curious about. There's so much out there and so many different supplements. So what I've done is I've tried to go through and put the most common ones out there that people talk about, and share some studies, not to bore you, but to give you an idea of, ways, if you wanted to incorporate it, how to incorporate it, basically. So some things to consider before we talk about this is that supplements and nutrients may be used as complementary therapy. So, they should be used alongside whatever conventional treatment you are recommended by your provider. They don't replace the treatment that is recommended by your provider. And not all supplements are created equal. It's not a regulated industry. So they can differ in quality and batches from bottle to bottle, from company to company. And I always recommend food first. You cannot out supplement a poor diet. And the effectiveness may be variable from person to person. So a lot of times you might hear people say, oh, this X supplement totally helped my kid. They're focused. Everything has been great ever since. You try it and you're like, I'm not seeing those results. So it may work for some, it may not work for others. And then certain nutrients, it's important to test for those nutrient deficiencies before supplementing. So just being mindful of which one those are when appropriate. Again, just a disclaimer, it's always important to talk to your doctor and have those open conversations about what you're considering, because there can be drug interactions if your child's on a medication. There can be supplement disease interactions. Some supplements shouldn't be taken for, specific populations of kids, and supplement drug interactions. So talking to a healthcare provider, local pharmacist, or somebody who knows, how to check for these things. So the first one I'm going to talk about is omega-3 fatty acids. This is probably one of the biggest supplements studied, and the biggest ones out there. And an important thing to note is it is important for everybody's diet, and your body can't really make them on their own. It does come through food or supplementation. So some studies show that children with ADHD actually do have decreased levels of omega-3 fatty acids in their blood. And when they were given omega-3 supplements, the researchers found that children showed improvement in focus and attention. So some takeaways here are that it may help some children, it may not help others. And in some cases, I read some reports of increased impulsivity. So something just to be mindful, and it should really be personalized to each child. The doses that were used in most studies varied between 1 to 2 grams of omega-3 fatty acids, with the mix of EPA and DHA in that. There is actually general population daily recommended intake for pediatrics, and this is, again, not just limited for ADHD. So between the ages of 1 year and up, the recommended intake is 0.6 to 1.2 grams. Obviously, the lower dose being for the younger age kids, and then kind of in between, and getting about to 1 gram, I would say, is pretty decent. Some kids might need more, but that's, again, something that needs to be talked to about with your provider. So as I always say, food first, and the highest concentrations of omega-3 fatty acids, especially the EPA and DHA, is fatty fish. So those fish would be wild-caught salmon, mackerel, cod, tuna, herring, and sardines, and eating those about 2 to 3 times a week. Some plant-based sources are walnuts, chia seeds, flax, and hemp seeds. So you might be like, okay, my kids won't eat any of that. It might be beneficial to supplement if you are interested in getting that, daily dose of that 0.6 to 1.2 grams. Some tips if you are looking into supplementing, is on each label, reading to see, how do they make it? Is it free of mercury? Some words you might see on there to show that it is free of mercury. You'll see USP, refined to eliminate mercury, and mercury free, or something along those lines. On the back of the label would be a smart consideration to do. A lot of parents also don't realize that it can take up to 6 weeks to see the benefits. So it does take some time to work. Some kids might be sooner, but it can take up to 6 weeks. And omega-3 fatty acids, you want to get them in the form of EPA and DHA on the label. So you'll see on the label, it'll say omega-3 fatty acids, it'll say how many milligrams, and then underneath it, it'll break that up into the EPA and DHA content. So you want to make sure that there is EPA and DHA written underneath that. I like to always say that the EPA should be 1.5 to 2 times more than the DHA for kids with ADHD. Liquid and capsules do provide the more adequate amount of omega-3 fatty acids. Most gummy and chewables don't have that, 0.6 to 1.2 grams in it. And if you are vegetarian, there is an option. It's called algae oil. The only disadvantage is that it's going to require a larger dose to get that adequate amount of the EPA and DHA. Iron is another important element in ADHD, and specifically ferritin. Ferritin is a marker that measures circulating iron. Ferritin is often low. There's been studies done to show that it is actually lower and borderline low in many children with ADHD, despite their hemoglobin and hematocrit being in range. Ferritin is also very important for sleep. So a lot of times kids who thrash around in their sleep or have like restless legs in their sleep may be low on ferritin. But the one disclaimer here is you do not want to give iron until the deficiency is confirmed by blood work. So this would be something to definitely discuss with your pediatrician or your child's primary care provider. While you work on figuring that out, you can always start incorporating foods that are high in iron. So heme iron would be more of the animal type products. So beef, pork, poultry, red meats, organ meats. Those are going to be the highest in iron because they are heme iron, which are absorbed better. There is also other food, plant-based foods that are high in iron as well. Fortified cereals, dark leafy greens like kale, spinach, and broccoli, dried fruits, legumes, and beans. Some tips if you are going to be eating iron-rich foods and one of your goals is to improve that iron, even if you're supplementing, is to take your iron-rich meal with some vitamin C to enhance absorption. So that doesn't mean you need to go get a vitamin C supplement. You can just use vitamin C-rich foods. So you could do like blueberries or strawberries or kiwis one day with that dinner that is high in iron or with your supplement. You also want to separate iron from calcium containing products. So that would be things like dairy, milk, cheese, yogurt, salmon from iron rich meals or iron supplementation, because that can reduce the iron absorption. And then you want to separate iron from zinc and foods that are high in phytates. So that would be whole grains and legumes, as those can also decrease iron absorption. Also, cooking in an iron skillet can help to get some of those levels up. Vitamin D is another one that a lot of people don't know could potentially be helpful for kiddos with ADHD. I've referenced a couple of studies here on just explaining how some vitamin D levels were actually lower in the blood of children with ADHD compared to healthy children. And then there was a study that actually showed that as supplementing vitamin D and getting those levels up helped with some of those evening symptoms that kiddos get at the end of the day, where they're just having a hard time keeping it together. If that sounds familiar, like your child, there was actually a study that they had done with kids who were on Ritalin, and one group had Ritalin and vitamin D, and then the other group just had Ritalin and placebo. And after 8 weeks, the group that received the vitamin D supplementation with the Ritalin had a decrease in evening symptoms and an increase in blood levels of vitamin D. So something to consider. A lot of times, you can try to make sure you're actually getting the adequate amount of vitamin D. And I put the general pediatric recommended daily intake. Again, not specific to ADHD, but just pediatrics in general is 600 IUs per day. Or if you're looking at a supplement label, that would also be, it could also be 15 micrograms per day. If you are truly deficient, you may need to have more personalized dosing. So that's another thing that you can chat with your pediatrician or primary care about. I know a lot of times vitamin D levels might not be covered by insurance, so just something to consider. So how can you increase vitamin D levels? Yes, you can get it through food. So foods like cod liver oil, trout, salmon, mushrooms, fortified milk, sardines, eggs, liver, tuna, chicken breast, cheese, and beef. Also, by getting direct sunlight, it's a great way to increase those levels, 15 to 20 minutes without sunscreen. But of course, be mindful of the time of day that you're doing that, the heat index, sunburn, skin cancer, all of that. Just be very mindful of the time that you might want to choose to do that. And then, of course, supplementation if you are not getting the adequate amount. Some other supplements that are talked about in the ADHD world are magnesium, zinc, and probiotics. So I'm going to talk about each of these, starting with magnesium. So magnesium plays an important role in regulation of several neurological processes. It helps to regulate activity of neurotransmitters such as dopamine, serotonin, and norepinephrine. It inhibits the release of this NMDA, which induced norepinephrine, which can lead to excitation of neurons. So it can help slow that down. And then it is needed for synthesis of fatty acids, which we just talked about, which may play a role in the development of ADHD symptoms. So that's kind of the thought behind why, you might see a lot of these magnesium supplements out there. But ironically, the studies are actually limited of giving magnesium alone to pediatrics for ADHD. Of course, studies are limited in this just because when you're looking at pediatric population, they're very careful on what type of studies they perform. But there were a couple that I did find of combination supplements that showed some improvement. So the first one was magnesium and vitamin B6. They used weight-based dosing of magnesium and weight-based dosing of vitamin B6 for 8 weeks. In almost all cases of ADHD, the magnesium and B6 regimen improved hyperactivity, aggressiveness, and school attention. And then there was another study that they combined magnesium with vitamin D, which we just talked about, and they used a specific dose of vitamin D with weight-based magnesium dosing. And they found a significant decrease in conduct problems, social problems, and anxiety and shy scores. So something just to consider if you are interested in learning more. This is the recommended dietary allowances recommended by the NIH of how much magnesium each kids should get based on their age. So you can take a screenshot of this and see if maybe you think your kiddo's getting enough. Of course, I always recommend food first. So these are foods that are high in magnesium. That would be pumpkin seeds, chia seeds, almonds, boiled spinach, cashews, peanuts, black beans, peanut butter, cooked brown rice, oatmeal, kidney beans, salmon, bananas, and raisins. Supplements, if anybody has looked at magnesium supplements, there's so many different kinds out there. Different types have different absorption. Some may be better at crossing the blood-brain barrier. The more bioavailable, which means the ones that are more that are absorbed better, are magnesium aspartate, citrate, lactate, chloride, and glycinate. Magnesium oxide and sulfate are a little less bioavailable. And then there's a few others that are being researched, magnesium taurate and magnesium threonate for different indications. Now, magnesium baths is something I just recommend. It's not going to truly increase your magnesium levels, really, but it's a gentle way to naturally maybe increase levels of magnesium without the oral consumption. I found that this can be just a really great added thing to try at bedtime for bedtime routines and for calming to kind of prepare for a good night's sleep. What you would do is get 1/2 or 1 cup of magnesium sulfate, so those Epsom salts or magnesium flakes, and put it in a bath and have your child just soak for about 15 to 20 minutes. Again, this is just relaxing and calming as part of a bedtime routine. And I wouldn't recommend doing this every day, but if you wanted to try, I would probably cap it at about 3 times a week. So to basically sum up about magnesium, we do need larger studies. The data is not strong, but suggestive that magnesium may be helpful for hyperactivity and agitation. Children with ADHD tend to be at risk for low magnesium levels, and children with confirmed magnesium deficiency may improve with magnesium supplementation. Of course, the dosing and type of magnesium used in these studies is variable and very inconsistent. But in general, magnesium is safe and well tolerated. The main side effect of it is diarrhea. Next supplement I'm going to talk about is zinc. It's not as well researched as omega-3 fatty acids and iron, but there is some positive research. There was a study that showed taking zinc with a psychostimulant, particularly amphetamine, caused a reduction, a 37% reduction in the amount of that medication that was needed to function at optimal levels for those children. And then there's other studies that showed benefits for general ADHD symptoms. It can be measured in blood, or you can supplement with a dose that's appropriate for child based on a recommended daily intake, which I have on a slide coming up. Of course, food first. So some of the richest sources come from animal products, meat, fish, seafood, oysters. Not sure how many kids eat oysters, but those are the highest. And other foods with higher amounts of zinc include pumpkin seeds, beans, grass-fed beef, lamb, sesame seed, garbanzo beans, lentils, cashews, quinoa, eggs, poultry, shellfish, raw sprouts, spinach, garlic, and peanuts. So here are those recommended dietary allowances recommended by the NIH based on your child's years of age. Some tips, I talked about this in the iron portion, so I'm going to talk about it now in the zinc portion, is if you are truly trying to improve your zinc status, separate that from iron containing foods or supplements. And then especially if you do have a child that has a confirmed iron deficiency, it can actually, taking zinc at the same time, can reduce the iron levels of the supplement or the food that they might be eating. So try to separate that. Probiotics is a really big supplement that everybody wants to know about. And I could probably do a whole talk on this, like a whole hour talk on this, but I'm going to try to just sum it up the best I can. There is a lot going on with the gut-brain connection. The gut-brain connection is basically the intricate communication that happens between our gut and our brain, and it is very important for our overall health. There's too many variables in these studies to really know which probiotics work, which don't. We do need better, more controlled studies, but we can modulate our gut microbiome through diet, particularly through fiber and fermented foods. So there has been research that shows fermented foods and fiber increase microbiome diversity. And so in our gut, we want there to be high bacterial diversity. That is good. We want our gut to be, have all sorts of different bacteria that helps decrease inflammatory signals and activity, not just for brain health, but for our immune health as well. So certain foods can actually help with this, particularly for fermented foods. So sauerkraut, yogurt, like I mentioned earlier, with live or active strains in them. A lot of times you'll find these types of foods will be refrigerated because they do contain some type of culture or something that needs to be kept alive through refrigeration. Kimchi, miso, kefir, tempeh, kombucha, and cottage cheese. Just, kombucha, I would just be mindful. Sometimes, some kombuchas do have black tea or green tea, which have caffeine in it. So just be mindful of that if you're wanting to give that to kiddos. And then I know I talked about integrative medicine. I mentioned that wheel earlier. And so some other integrative approaches just beyond the nutrition and nutrients for ADHD that can be looked at are to, of course, limit screen time, decrease some of that electronic use in social media. Sleep hygiene is really, really, really important. I could probably do a whole talk on that. And then identifying stressors like parenting skills, behavior interventions, physical activity that works for your child. So I always talk about joyful movement, not, forcing your kid to run several miles before going to school and sweating. Yes, sweating is helpful, but finding things that they also find joy in and that bring them happiness. There's been some research on meditation and martial arts and even like biking and how it stimulates different parts of the brain for kids with ADHD. Time in nature is just great. Mindfulness training, yoga or meditation, which I just mentioned. Hypnotherapy is, it's really cool. It empowers a child to use self-help tools to help them help their ADHD symptoms. And then unstructured play, especially for the little kids, just letting them be free and letting them be kids and exploring and learning just on their own without, somebody telling them kind of what to do all the time. But that is about it. I want to kind of see how long I took. Okay. So does anybody have questions?
So I'm not seeing any questions in the chat right now, but if anybody has any, definitely pop them in there. That was wonderful. Lots of great information.
Yeah.
Always heard that about the magnesium and the iron and the zinc. So it's nice to have it like in front of me with data to back it up. That's great. If you do have a question, go ahead and pop it in the chat, or if you want to unmute and ask real quickly, you can do that. We've got about 10 minutes left in the presentation. I guess you answered everything. You were very thorough.
No questions? Did anybody download the recipe guide?
I think several people tried. I know Dr. Steppi posted it in the chat as well.
I have a question.
Go ahead, Megan.
I was looking at Nordic Naturals. It's the EPA Extra that has It recommends 2 soft gels. So the total is 1480 milligrams of omega-3s with 850 of EPA and 425 of the DHA, which sounds on the mark, but it has 25 micrograms of D. So should I just give him one?
I'm trying to look at, okay, so it says 2 soft gels. Well, could you put like a link to it? I mean, I might be looking at a different one through my Google.
I don't know how to do that.
Yeah, the one I see, I don't see the vitamin D in it, but
it was the it's EPA extra, I think is what it's called, omega extra with just an XTRA. Here, where's the thing?
If you find it in the chat, that would be great. We can circle back to that.
Okay.
Let's see. We got a couple questions in the chat. So Sarah was asking about the supplements. Like if you got a picky eater, how do you determine where to start?
yeah, that's a great question. So I will say you can use like supplements as a bridge while alongside working on diet, I think is important. There's a lot of multivitamins, but I don't know, with the ones for the kids, Dr. Seppi, I know you've probably looked into this too, but a lot of them just don't have a lot of stuff in it. So that's why I like looking at specific nutrients. But are you just asking like what supplements to give, or if for a picky eater, what to do, or could you have like a more specific question?
That is all that's.
Oh, hi. Yeah, I was just actually just kind of wondering where to start. Just, like where to start, because my kid won't eat foods, like any of the foods that you mentioned. They take a multivitamin, but should I start with iron? Well, I know that would need probably a physician, but just should we start with multivitamin, or is there, I don't know. It's just a lot to think about.
It is. It can be very overwhelming. And that's why I always talk about doing just small changes. So, and also giving them the chance to try it and being consistent, and not, and I know like a lot of these foods, like especially the omegas, most kids are probably not getting any of those. But I would pick, if there's certain packages that your child's eating, maybe slowly reducing that, or I like to, give them a preferred food and then just put the other foods around it. A lot of times I talk to kids about mindful eating too. So, in the beginning, if they're not interested, they're not even going to put it in their mouth. Just having it on their plate is a win. Having them smell it, having them even lick it, touch it to their face, using, a toothpick. A lot of times I also recommend doing, I call it a family food challenge. So instead of focusing on like every meal and worrying about the fact that they're not going to eat, this wonderful, plate of all the varied foods, starting slow and getting the whole family involved. I call it a family food challenge, is just picking one food each week. And like right before dinner or before your meal that you all eat together, is everybody has to just, try it, lick it. Even if they spit it out, it's okay. And doing that for 7 days and coming up with a family goal. Like if we all do this, we can come up with a goal. And I always like to say maybe like non-food goals. So, we can go have like, stay up late on Saturday, or we can watch this movie, or we can go do, whatever it was, a family game night or whatever. But starting with something slow like that, that's not going to overwhelm a child who is picky, who's not going to probably eat anything, and making sure, the siblings are doing it, the parents are all doing it together. And it can be something so small as a nut, or like one seed, or you know, and I wouldn't start with something that, you know, they're gonna have. So I would pick something that, you know, that your child would be interested in, or is at least not going to be disgusted by. And just starting with like a very small piece of it. It just needs to be something that we all touch, and you can touch it. You know, the rules can be as flexible as you want. You can touch it, you can taste it, you can lick it, you can play with it, you can use a toothpick to pick it up if you're not interested, and then rotate that food each week, and just start having those conversations too of like, hey, we're just trying some new foods in our house, and starting there before you completely just put a, you know, plate of salad on their you know, the dinner table.
Okay, our next question is, how common is it for pediatricians to test for vitamin and mineral deficiencies like magnesium or zinc? Is that standard practice, or does it only come up if there's certain symptoms that present?
Yeah, so most of the time, yeah, like magnesium isn't going to be checked. That's usually if there's something, you know, major, something else going on. And then it depends on the insurance too. Iron, I would say, is more frequently checked. You probably have to just talk to your doctor and see, and I don't know, depending on the insurance too. You could certainly ask, but you know, most there is talk, like most people are probably just deficient in magnesium. It's just not overdoing it on these supplements is the main thing. You know, like vitamin D, it's hard to take too much of that. But again, you want to stay somewhere within that range of the recommended daily intake.
And then are there certain brands that you recommend for kids? I know like some, like for my kids, you know, some of them like the gummy version of whatever. So we get that one, and some like the nature made version of this one. And so we get that one because it tastes better or something, or the capsule smaller or whatever. But do you have any, like, I don't know, common ones that you recommend?
Yeah, so I'm not like aligned to really any brands, I will say. I do try to stick with the ones that I know you know, like I do like Nordic Naturals, whoever brought that one up. There's other brands, but gosh, I don't like to throw out brands because I know that some brands are good and have the gummies that have good amounts, and then some don't. But really, yeah, I don't have specific brand alignments, I would say. Yeah.
Okay, yeah, it's just kind of trial and error then, huh? Figuring out which ones have the stuff that.
Yeah, more of looking at like the quantities and the quality, and researching the brands too is helpful.
Cool. I think that's all the questions we had in the chat. Anybody need additional clarification on anything? Dr. Ross, thank you so much for joining us this evening. This has been incredibly informative, and I think that there's lots of people that have learned a ton from your presentation. We really, really appreciate you doing this tonight.
Yeah, thank you all so much for joining.
Take care, everybody. We'll see you hopefully next month at our presentation on Tourette and ADHD and driving. And the recording of this presentation will be available once Dr. Steppe edits it. Because I remembered to hit record this time. Yay me.
Yay. Thank you so much. And I do have to just put the little plug in as a pediatrician. I absolutely love that she doesn't align with any supplements, because one of the big red flags is she's trying to market and sell her supplements at the end of the show. So
No, definitely not do that.